if you've treated a child with Pial synangiosis, if you've done an operation on a kid, what happens after that? You know, we know from looking at hundreds of these children we've operated on here at Children's that have been followed not just for a few months, but for years and in decades in some cases, that we can reduce the stroke rate, again, from the 60 to 90% range down to about 4%. So we know that there's a durable, long-lasting effect which is seen in these kids for years and years. It is very rare that we ever need to reoperate on children or to bring them back for subsequent treatment, although we certainly do follow these children, and we get an angiogram usually at 1 year after the surgery, along with periodic MRIs to make sure that the brain is healthy and the surgery is having its desired effect. Some of the folks that we're a little more concerned about are the children who have disease on one side of the brain and the other side appears healthy. And we've published in looking at these kids that about a third of them or so will progress in a relatively short period of time, meaning a few years. And so these are kids where we have a little bit of a heightened sense of urgency about following them with MRIs and occasionally angiograms so we can find the disease, if it happens, early. So although disease that has been treated successfully almost never needs further surgery, although it can happen on occasion. There are certainly times where we want to monitor other sides and make sure that they do well. We also keep them forever on aspirin and on hydration to make sure that they're able to reap the most benefit of surgery as possible.